with a pro-life ethos, you would want to do anything in your power to encourage a woman to choose life rather than have an abortion, or you would want to do anything in your power to keep a baby alive, even if it had some really challenging medical concerns. But how do you handle situations where the only way that that baby can be kept alive is through the use of technologies that raise other bioethical concerns? And I'm not even sure what all those ethical concerns are, but I know they're there in terms of where we get certain medical resources from. And I don't know, you can take it from here. There must be some really tough situations that come up in your field.
Sure. And so this is complex. And one of the gifts that the Catholic Church gives to the world is, or to the United States anyway, we have the National Catholic Bioethics Center, and they do free ethics consults. So if there's somebody who is in that position where they have a serious life-limiting diagnosis, and sometimes doctors are trained to call them fatal diagnoses, which is not always accurate. So they can actually take the specifics of their situation and get real-time help for free. Just they can call, they can email to get trained ethicists to help talk them through that situation, because doctors don't have necessarily, unless they have an interest in it, they don't have a lot of robust ethical training. So it's a very helpful, I think, resource that people can access. And so I'll just speak generally, but especially in a situation like this, those ethics consults are so helpful because the particulars really do matter of your very specific condition. So in terms of abortion, we know that the best thing for the mother in those situations, the mother, is to carry to term. There's a 98% absence of regret, and there's a much lower instance of those postpartum issues, depression and anxiety and things for women who choose to abort in those situations. Their numbers are not so favorable. So we know that it's better for women, if you want to set the question of life aside there and just look at what's best for the mother, she will fare best in those situations. And so sometimes that means that she does eventually go on to have a miscarriage. It's not the same thing as an abortion, recognizing that when life passes and that life is over. But sometimes these moms get to actually give birth to and hold their babies, baptize their babies, enjoy life, even if they don't provide any kind of support afterwards. And whether or not they ought to, that's something that they should pray about, talk about with their family, with their religious leader, with their doctors, because sometimes those kiddos can have really, really good positive options, a high likelihood of leaving the hospital and continuing to survive, even sometimes up to 5 years and longer. And sometimes it's not. And sometimes those interventions, if they do choose to employ those interventions, it's not a prolonging of life, but a prolonging of the experience of dying. And so that can be really painful for the child. I mean, it's painful either way, right? To watch somebody that you love go through a serious amount of pain, to struggle for life. And so it's very personal. But I think the assumption maybe from, secular perspective is that, well, religious people, and maybe even from a religious perspective, well, we have to fight for every second of life because life is good. But from a religious perspective, yeah, life is good, but it's not the only good. It's not the greatest good either. And so when you understand life in terms of eternity, we have our physical life here, but sometimes baptizing and holding those babies for as long as you can, and enjoying that time that you have until they take their last breath, holding them in your arms. That's the best gift as a mother, as a parent, as a father that you can give to those kiddos. And then to also be able to let them go and to pass into the arms of their Heavenly Father.